I want to tap into those thoughts from you as a visionary for a moment. If communities and governments across the province or country, for that matter, were to fully embrace a well-being framework in their decision making, in their budget making, how different would the world look in 50 years?
Yeah, I'm not sure what the end state would exactly look like, but I know what the process would look and feel like. But it first would begin with a public narrative that increasingly focuses on things that are related to our interdependence, combined with our need for freedom and agency. But if we want a more equitable, inclusive, resilient, and vibrant society, from my perspective, it does include certainly budgets that recognize more effectively where the pain points in society are and creates the conditions for people intergenerationally and in communities that have not yet been seen to sort of have the opportunity to sort of become full participants in our society. So that relates to budgets, it relates to public policy. None of that's going to come about as a result of leadership just from government unless they hear the chorus that, in fact, this notion of quality of life is something that we can all stand beside and around. It's demonstrably true that while a vibrant economy is an important condition for us to have a healthy and inclusive society, we've been asking the wrong question. And the notion of just looking at a horizon and asking together without ideology, do you like this notion of well-being, of improving our quality of life for everyone? And I think that frankly, no matter where somebody sits on a political spectrum, is something that we can get behind. And if we do, and if we take enough time and we put real energy into the next couple of steps toward that, then over time, we will ask ourselves, why were we doing it that way when we could imagine a thriving for our children, for our parents, for our friends?
Yeah, I think that we would hopefully continue on the trajectory that we're on, that more governments would take a more comprehensive and multidimensional approach to understanding and measuring child and youth well-being, that would have a tighter linkage into investments in children and policies that support child and youth well-being. It would sharpen the focus of research and evidence. I think in Canada, we would have the opportunity to understand that the child outcomes we have are the child outcomes that we pay for. We are underinvesting in children relative to many other high-income countries in two key ways. One is that we don't spend very much after childbirth in the first few years of life when investments have such high returns across the lifespan. The other thing that I think would change in Canada is that we would stop underinvesting in the social protection and care policies. And that's where I think we would continue to grow. I think for Indigenous children, they tend to do much better when they're living in self-governed communities and jurisdictions. So continuing the progress to ensure that Indigenous peoples can be self-governing will also make a really big difference to child and youth well-being in this country and the fastest growing child population in this country.
In the kind of blue sky thinking way of looking at well-being, I think it requires a major shift in thinking from one where we're emphasizing continuous and never-ending growth. And we've used that as a proxy for well-being. We actually talk about financial well-being and financial health. So we make those links between, the economy and what we have and our income and well-being. And I think we can shift, and we're seeing shifts in other areas such as climate change and increasing recognition of the need to act on climate change, and think that we can build societies where more people can do better, and doing better doesn't have to mean growing economically and making more and more money. It can be measured through how we feel about our lives and the social connections that we have and our ability to draw on pools of resilience. I don't think in the end it's that big of a shift. It's a question of moving that priority and probably of recognizing how that shift doesn't have to mean, and it doesn't mean, economic collapse. That we can shift our priorities and make health and well-being and happiness and social connection the focus of our policies more directly, whereas now we tend to think of them as outcomes of economic growth. We can make those the starting point. It seems simple, but it's a question of priorities and focusing on the right things in the right order.